Hello, my good friends. First, my thanks to everyone at Lucile Packard Children's Hospital and the Children's Health Fund for the opportunity to talk to you this morning and for the extraordinary work you do on behalf of our children. I think you understand why I can't be with you in person. On Sunday, March 21st, I had the high privilege of making good on a 100-year-old dream, your cause and mine, and that of so many others, and that is to make health care for all an American commitment. It's an historic legislative achievement. According to a UCLA study just released, the number of Americans without health insurance coverage is now 8.2 million people, 1 in 4, up 28%. Among those newly uninsured are 1.5 million children. An estimated 100,000 of these children live in San Mateo and Santa Clara counties, the children I represent. It's an unimaginable number that in the midst of plenty and in a place renowned throughout the world for the finest doctors and the most advanced medical research and technology, that there are children who are sick and in need and who cannot be helped. The numbers speak for themselves, but we know how deeply personal this is. As a mother who has held a sick child in her arms, it's painful to consider that there are parents who have to weigh getting treatment for their daughter or son against tomorrow's meal or today's electric bill. The topic that you're considering today is why California's children need health reform. There is one simple and indisputable answer. Everyone deserves the right to good health care. From that right flows all of our most basic rights, including the right to life, liberty, and the pursuit of happiness. To guarantee those rights, everyone deserves health insurance which they can afford. I was proud to cast my vote in support of the health care reform legislation. The bill expands coverage to 95% of all Americans. It reduces our deficit by $143 billion over the next 10 years and by $1.2 trillion over the next 20. Importantly, the legislation includes a pediatric specialty loan forgiveness program. As you know so well, the workforce shortages in pediatrics aren't the same as adult medicine. While geographical shortages in general pediatrics do occur, the most pronounced shortages across our country are in pediatric subspecialties and pediatric surgical specialties. These physicians care for the children who are most vulnerable, especially those with chronic illnesses. And so I did everything I could to see that the legislation encourages physicians into these areas of medicine. The bill I voted for fundamentally improves the way we interact with health care by focusing on wellness and prevention, and I'm confident that we're on the threshold of a health revolution, a revolution led by Lucile Packard Children's Hospital and the Children's Health Fund. It's a revolution of the mind, of attitudes, and understanding of what it takes to live a much healthier life. And the revolution has to start with our children, teaching them how to care for themselves, how to eat properly, how to exercise, and how to lead a life of well-being that prevents heart disease, obesity, diabetes, and many other diseases. That's why children are at the heart of this historic health care reform legislation. I can recite all the arguments why this health reform package is necessary. The debate has gone on for so long, probably all of us can. Just in my district alone, it will provide coverage to 23,000 uninsured residents, improve coverage for 461,000 of my constituents, protect 800 families from bankruptcy, provide $25 million in financial relief to hospitals and other health care providers, and deliver millions in new dollars for 21 community health centers. It will help our economy, it will reduce our deficit, and it will guarantee that children with a pre-existing condition can and will be insured. We were urged on in this mighty battle by the happy warrior, the courageous champion who fought like a lion for the sick, the elderly, the left behind, and the voiceless, my friend and mentor, Senator Edward Kennedy. I am and always will be inspired by the extraordinary work done every day at Lucile Packard Children's Hospital to humanize medicine and to mend the spirit as well as the body. And the Children's Health Fund has helped in countless ways to heal and to educate. In the last words Senator Kennedy wrote, he said, "If you persevere, stick with it, work at it, you have a real opportunity to achieve something. There will be storms along the way, and you may not reach your goal right away. But if you do your best and keep a true compass, you'll get there." Thank you to every member of the Lucile Packard family and the Children's Health Fund for being my compass. I believe together that our work continues to perfect our union. God bless each of you, and thank you.